a crazy time. I guess we probably have folks that have accumulated. Maybe we'll give it another couple minutes before we kick into it. Probably the last time you and I were just catching up personally, it was a few months into COVID, right? And that must have been a few months back at this stage.
Yeah, it was May, June, something like that. We were debating how this is all going.
Yeah. So I'll be curious for your updated outlook. I know you have a subtle understanding of the forces at work. So we'll do some healthcare stuff. We'll do some economy stuff. Probably need to do some just pure leadership and touch on some politics, things like that.
Yeah.
And you're fine if we record and share this thing later, or don't record and don't share
it's okay.
later?
Definitely.
Yeah? Okay. Yeah, because we've had, you're in good company in a way. There's been some really excellent company leaders and things that we've had that are starting to be part of the library. So maybe we'll just get started, Mario. For everybody who's joining, thanks for joining our series. We're doing a conversation today with an old friend of mine who's the co-founder and the CEO of Oscar Health, Mario Schlosser. Hi, Mario. Nice to be here. Hey, Amol. Good to see you. Yeah, it's amazing to have you together. I haven't been in person with you for just months and months, but we started a long time ago when we were both on the Stanford campus as students, and I guess we've had like a somewhat intersecting path over many years between entrepreneurship and some big institutions like McKinsey, and I guess you were also at Bridgewater, which I think maybe has more effect on you than McKinsey when I hear you talk about how the world works and how to master it. It's a good question. Yeah, I mean, it's actually kind of funny how we met. I was just thinking about this again. That's right. I was a visiting scholar in computer science at Stanford, and you were, I think, a philosophy PhD student, right? And I went to one of your talks, I think it was about deconstructing the human thought process or something like that. So you had some theory of modularization of the human brain that you were advancing or researching. Yeah, that was my dissertation. Yeah, the brain, the mind has parts and they work together. And and then I actually lost touch with you, but then I was in a McKinsey training seminar, and I saw a calculator on the desk that I was using, and your name was on it. I'm like, I know that name, and so then I reached back out again. That's how we then like all kinds of twists and turns there. But yeah, I think these places all leave an imprint in you in one way or the other. I think Bridgewater is an interesting place because it had this sort of like same modularization approach or deconstructivist approach to the global economy that you had to the human brain. And the fascinating thing that everybody knows Bridgewater for, besides being the biggest hedge fund in the world, whatever, is the fact that eventually the founder there, Ray Dalio, turned that same modularization, deconstructivist approach to also how people interact with each other and live their lives. And it's a fascinating sort of like way of thinking about leadership and interactions between human beings and stuff like that. Can you distill it down to simple formulas? Can you write them down? And then can you basically live by those formulas and sort of like optimize them and find some kind of global optimum there in a sense? I don't think they found a global optimum, but they've certainly made money in the process. So it's got to be working to some degree. Yeah, it used to be a Xerox copied or PDF document people would circulate, but I guess these last 4 or 5 years, Ray Dalio has become way more visible, and he's published the book, and he's out there at Burning Man or at TED or whatever, explaining his principles for how everything works. And it does bring us to the topic of leadership, right? I mean, I don't know that you can just pick up the principles book and lead any organization or solve any problem. I suppose it works for the investment business. But I've often thought about some of those ideas as we've been dealing with this year, right? I mean, our topic is just how do you deal with recession, crisis, political war, health crisis, all this stuff at the same time. When your job is leader, how do you lead in a situation like this? And I guess you're sitting on a perch that I'm really curious to learn from you about for that problem. I guess it's been 10 years. When did you start Oscar? You've built a really important business that maybe not everybody knows about, but it was sort of around the time of the new Obama healthcare law, and it was like a new consumer-driven health insurance business. Maybe give us a little capsule of the journey and what the business looks like now, and then we can investigate what it looks like to try to lead that. So Oscar
started in 2012, and at the time I had no idea of really how healthcare works or health insurance works, and we are a health insurance company. The motivation for starting it really was when my wife was pregnant with our first kid, who's now also 8 years old, like the company, easy to keep track of there, got 2 kids, and the company as well, which is, I guess, about to hit puberty, in a year or 2 from now, whatever. And the idea very simply was that US healthcare, when you navigate it, whether through pregnancy or an illness you might have, you realize it's too complicated and it's too costly. And it's crazy costly, right? We're spending about twice as much on a per capita basis on the US healthcare system than really any other rich country in the world. So we spend about 18% of GDP on healthcare. Switzerland, I think, is the next expensive one, spends about 12, 13%. So there's a massive gap there. That's on the order of like $1 trillion or so per year in overspending in the US healthcare system. And so you don't really see the quality of outcomes that you think you could buy for that amount of money. We were ranking generally worse in the US in terms of chronic condition management and even maternal mortality and infant mortality and things like that.
Which is a little jargony. I mean, when you read people on this, they usually use terms like that, like outcomes or whatever, but like it's super basic. Just people die younger in America than they do in peer countries. And that what that means is like your parents die 5 years earlier, or, children have terrible, it just happens more often here as if we're a much poorer country.
Yeah, and life expectancy in the US has gone down in the last couple of years, not up. One fascinating statistic is that if you add together the percent of GDP spent on healthcare, which again in the US is insanely high, and there's like no equal to the US in that, right? Generally, the Western world's around 9, 10, 11% GDP, US.
And we're like 20, right? Or 18, 19?
18 at this, I think close to 18 now at this point. So that there, the US is a crazy standout. If you add to that the percent of GDP spent on social services, and you then basically rank countries by that, then the US is sort of in the middle of rich OECD countries, which basically means we vastly underspend in the US on social services and we vastly overspend on healthcare. And the two are almost certainly very related, right? That's where you have sort of like the issue of systemic racism in society come in. It leads to mental health, worse mental health outcomes. It leads to, worse maternal mortality. Black mothers are dying at a much higher rate in childbirth than anybody else in the country. And so you can't really de-intertwine. I don't know what the word is for that.
Disentangle, maybe?
Yeah, probably take these two issues apart that easily. And so what we thought now for Oscar really was that from the health insurance sides, there at the time really wasn't, and I think there still isn't, besides Oscar, an insurance company that said, I've got to first and foremost engage the member, the end user here around their healthcare. I got to make sure you use our tools to find physicians, to check with a telemedicine doctor on what's going on, to see quality outcomes, cost data about physicians you're going to go see, and things like that. And then get incentives from the insurance company to sort of like get on the
be more healthy.
My own healthcare. Right?
Yeah, I think for like your average person, this idea has been kind of out there. You sort of see some app or see some safe driver credit or something from a car, but I guess your car insurance, but these things are not implemented in a way at any scale that they actually matter, that anyone cares, right? Like I've never told my insurance company that I run 25 miles a week. It seems like I'd like my credit for that or whatever. Yeah. I mean, some kind of interaction between us. Yeah,
and the beauty of being the insurance company is that again, healthcare is about 1/5 of your income, right? That's what it means to be 1/5 of GDP, pretty much. I mean, not of every average person's income, but sort of like on average of everybody. And so it means it's one of, by far, probably the biggest spends you have on anything in your life, even though you don't necessarily realize it all the time, right? Your employer takes money out of your paycheck and gives it to the insurance company. All these things happen behind the scenes. And so that means, though, when you are the insurance company, you can take some of this money that otherwise would go into waste in the system, and you can say, let me give this back to you as the end user in the form of, for example, free telemedicine, which in our case, the math is very simple. We've given people free telemedicine since the very beginning. It's now free virtual primary care. You can pick a doctor in the cloud. That care with that doctor will be free. The lab tests, the drugs for that doctor will be free as well, as long as it's that Oscar doctor. And we can do this economically because we can save money down the line for kind of worse quality care you might otherwise get, or less efficient care you might otherwise get.
So this is a good sketch, Mario, of like the problem and the sort of vision for trying to fix a really deep issue that makes people sick and makes them die and impairs the American economy, right? And your way of doing it. How far have you come? So, I don't know, you're probably not one of the biggest insurers in America yet, but you're a pretty significant player in some regions, and you've got some workforce, because we're going to get now to the problem of how do you navigate the organization you have in the world that we've been in.
Yeah. I think from my point of view, I thought when we started an insurance company, we were the first newly licensed insurance company in New York State in 25 years or so. So this idea of starting insurance companies is not a very common one. There was no category of insurtech, whatever, when we started in 2012. That's now a whole category in and of itself, right? That didn't exist. And I think we were therefore the first one of anybody really doing a tech-driven insurance company. And so that was both a terrifying reality and an exhilarating reality of being able to kind of blaze that trail. But I also knew this would take a couple of decades to really get right. Where I think we've done well is we have the highest member engagement of any insurance company out there. So, half of the members, when they're looking for a new physician, they find that doctor through Oscar. 1 out of 5 physician visits, even pre-pandemic, was with one of our telemedicine doctors. I'd say all of these rates are about 10 times higher than what the number would be for any other insurance company out there.
Wow. That's
really good. It's about 2.3 billion revenues now. So we've got a really nice run in getting to more states, more cities, insuring more people. And I think most importantly, this was all in the ACA individual markets, where if you previously were uninsured in the US as a freelance designer or a freelance coder or a cleaning man or woman in South Florida or a university lecturer in San Antonio, Texas, you couldn't really buy insurance for the most part. And now you can, and we can deliver this to you. So that I think makes me very proud. We've got great stories of members being very happy with Oscar and us helping them get to the right healthcare. And I think really get healthier as a result of what we do. And that's good to see. But of course, I think changing the trajectory of healthcare costs in the country will take another 20 years,
Well, and then this year, suddenly there's a huge and different challenge, I guess, that emerged in February, March. COVID starts sweeping around the country. It must have been a really confusing time where you're not sure if it's going to blow up your business or make it more attractive because people really want to buy into health insurance, or now there's a big recession and many of your end user customers maybe don't have any money to pay for it. I wonder what the dynamics have been. I casually have just observed, hospitals seem under a lot of stress, but no one's really doing normal healthcare stuff. So maybe they're not making money on the things that actually make them money, and they're having to staff up for things that don't make them any money. Is that true in the insurance business? Is that, what are the forces at work that you've seen?
Yeah, I think the first thing we did back in March when actually in February, when this all became more real, is we started saying, who's going to get affected by this in what way among the Oscar members, and how can we best help, right? As the insurance company, again, we pay for all of your healthcare. So if we can make sure that you don't have a worse outcome or you have a better outcome, that is kind of both obviously good for the member, but also actually helps the business in the end, right? It's a more efficient company as a result of it. So we were the first insurance company back in March, then in early March, to build a nationwide testing location directory. So we can tell Oscar members right away, no matter where they were, here's where you can go and get tested. And that was in March extremely difficult. We didn't know which ER to go to or which urgent care had testing available, stuff like that. We could tell that pretty quickly because it's the kind of thing we do in the plumbing of Oscar to build physician networks, hospital networks, piece that together, get the data out of the network and things like that. We were the first insurer to have a pretty simple risk assessment workflow to tell you could tell us as a member what's going on with you, who did you have contact with, and we kind of gave you a very simple pathway, including with our own telemedicine doctors, as to what you should do about that and what you can do next. That continued throughout the pandemic. The thing we are most proud of, among other things, in the last 8 years, is that we built all of our own technology, our own services. We don't outsource any part of Oscar. Some stuff like drugs, we have to use a vendor to make sure we get good contracts, but we do everything else in-house. And so that means we could react very quickly when we saw people couldn't refill, their drugs, can deliver to them, or people couldn't refill their, medical equipment at home and stuff like that. We can jump in there quickly. And so that, I think, helped members of Oscar really have a great experience throughout all of this, and be in good hands and safe hands and all of this. And so we actually grew more than we thought throughout the year, as people unfortunately lost their job and therefore the employer coverage, and then became clients in the individual market that we are in. But also fortunately, as people who otherwise didn't think they should buy insurance now realized I should probably buy insurance, which is always better to do, right? Always better to have health insurance and actually do that. And in the ACA marketplace, you can get government subsidies oftentimes that actually make this affordable, not always, but more affordable than was ever the case before. Internally for the company, we've all been remote since March. That's had its own challenges. You and I talked a bunch about what works and what doesn't in that. I think we've become, hopefully, I would say, even more transparent as a company, weekly, hour-long all hands, sometimes even longer. Lots of data information sharing. I used to record a video early on once a day about my thoughts on the pandemic or whatever. I eventually gave that up. I ran out of stuff to, new stuff to say every single day, But it was a time, I think, for experimentation in how companies can run and can operate, and how kind of people can interact with each other as well in different modalities. And I think we've mostly excluded stuff that doesn't work. I wouldn't say we've found stuff that works very well if we were always to remain in this way, in this remote way. But we've gotten through it so far.
Yeah, let's turn to that a little bit. So, your people, I guess when you joined on our conversation here, you mentioned, I just got off an all company, all hands. And maybe you do them every Wednesday, I don't know, but today is an unusual Wednesday. Big, huge, incredibly emotional election yesterday in the US. And the result was not clear, probably when you got on your all hands in the morning. I think maybe it's a little more clear at this moment at 1:15 Eastern time. But were you just reacting to like the election and just speaking to your people on that and gathering them together? And I mean, this is not the first time you've had to do it this last few months either, is it?
Yeah, we had some. So it was an extraordinary all hands. We have a weekly one on Thursdays, which means we have another one tomorrow. But I wanted to get people together for the election and to discuss what I think about it. And I told people at the beginning, don't expect a more well-formulated thoughts than your favorite writer can give you, and don't expect a more emotionally loaded or enriching thought than your family members can give you. But what I can tell you is I can tell you about the impact of this on Oscar, right? And obviously everybody in the company has a job with Oscar, and they want to know about that, and they care about the members. They want to know about, is there any sort of like implication of risk to our members' coverage that we provide to them? And I could give a little bit of kind of personal thoughts from being a foreigner in the US. I was born in Germany. I came here for the first time when you and I met at Stanford in 2001, 2002. And my wife's Brazilian, not from here either. And so therefore, I've got some maybe unique thoughts from that perspective. And so the thoughts I shared were first about Oscar, that I actually don't think that this has deep implications for health insurance coverage in this country. Fortunately not. The ACA market's not pretty stable. It's got basically 50 million people or so in coverage now. No politician, no matter their stripes, would be crazy enough to dial that back to zero. That's just idiotic, and would be so dumb that even the dumb times we live in, I think that like exceeds the dumbness we generally have out there. And I think that's what we saw also in the 2016, 2017, 2018 timeframe, when the same political winds were blowing, right? And that the clock wasn't going to get dialed back to zero there. And the Supreme Court isn't going to blow up the ACA, in a fatalistic kind of way. It's not going to happen, And people heard me talk about this before, but it was good to reinforce that. So no matter what then happens with the kind of betting contracts there right now in the election that I'm following to get an idea of who's going to be in the end the president there, members of Oscar will be covered, and employees of Oscar can keep standing up for their members. That I was convinced of. On the personal side, I think I'm overwhelmed by how polarized the country is. Certainly am. I'm worried about, no matter your political leanings, about wondering if we are heading into a time of great oversimplification. In Germany, obviously, right, 80 years, 90 years ago, so for 15 years oversimplified everything, and then spent the next 80 years having to overanalyze everything to get out of the horrific consequences of that. I don't want to go back to that kind of a time on the global stage. And I think that's sort of like where it's going at the moment, right? That simple answers to complex problems that are elegant, neat, and yet wrong are sort of like ruling the day again. That worries me with sort of like the big historical context I personally have there. What I also reminded people of, though, is that there's a reason why I came from Germany to the US, and it's that the US is an idol for many, many countries and societies in the world. So what happens here has big reverberations for the rest of the world, both in good ways and in bad ways. And if you can get through tough times, and I told people that Oscar's gotten through tough times, and I'm sure Knotel's gotten through tough times, right? You look back at that and you'll say, well, that was formative for us, and it's inspirational for everybody who comes after you. And so I think if the country can pull together, then you look back at this and say, wow, this is a big experiment in excellence in democracy that in the end worked out well and better for the whole world as a result. And so I hope that's where it's going to go. No guarantee it will, but I think it can. So that's what I told people, and I think it hopefully resonated.
Yeah, I think it has a lot of the bones of a great political speech, Mario. You may have some options ahead of you. But the problem you talk about, and I don't want to wade all the way into the politics. I'm miserable too, and it's been a really difficult few years. And hopefully we can get ourselves back on a better track. But this like oversimplification is a good one. Sorry. In all these months, I've literally dropped my my earpiece.
Drop the mic.
Hopefully we can get on a better track. But this like oversimplification theme is really interesting. We were just discussing this a little bit, right? I mean, the current president has had some very simple and probably wrong ideas about a lot of stuff, right? But to interrogate that a little bit with you, right? So you're doing your all hands, and you probably have to do this every 3 months for the last 4 years. No one's going to kill the ACA. These markets are too big. There's too many people on it. No matter how insane you are, there's no politician, there's no Supreme Court that could possibly reverse this thing. And you can say that with a lot of conviction, and I believe you. It sounded convincing to me. But there must be moments where you're not so sure. Yeah. There must be moments where, anything's possible. And somebody could pass a law or do a thing that makes your company illegal. If there's a sunset on it 12 months from now, no renewals or whatever, I certainly faced that sort of crisis this last 6 months, right? I mean, my product isn't healthcare at Knotel. We do workplaces at Knotel. And basically every government in the world passed a law or a regulation that said you can't use any workplaces for a certain amount of time, whether it was 1 or 3 or 6 months or whatever. And all these lockdowns have made it very hard for our customers to use their thing. So what about that? I mean, are you forced to have that level of oversimplification to give people some orientation on where to expect and where they're going?
So I think you have to, yes. I mean, I think, again, not to become too speculative here, but the success of oversimplifying has certainly made me think, is my approach to information sharing wrong? We have values at Oscar. We say publish even if it hurts us. Even if we have bad data, tell the rest of the world. Eventually, we sort of like say, hey, have a scientific approach to everything. And I thought, in a increasingly complex world, maybe that isn't the right way to go. Maybe it is simpler to sort of like pick one direction and that's it. You just kind of keep going, and it doesn't matter which direction it is. It's actually one of my McKinsey partners told me this very early on. He said, if you're lost in the woods, pick one direction, go, that's the best you can do. It's not a bad piece of advice, though. If I'm quoting people, let me quote another one now. I think you can get to a simpler articulation of a complex problem if you do the work. And that's the thing that's been missing, I think, in the US in the last 4 years, and the rest of the world as well, for quite some time now, This is another, like Joel Klein at Oscar likes to say this. I could have kept myself briefer, but I didn't have enough time. Right? This idea that if you want to distill something to its essence, it is very difficult work. There's a Nobel Prize laureate named Eric Kandel, who researched the brain a lot at Columbia University. He wrote a book about great artists and how their brains function. And he told me at some point that if you, as I think it's in the book actually, if you look at Picasso and how he draws, right? I mean, he's sort of like the epitome of really unbelievably simple shapes that stand for a lot. He didn't start drawing this way. Picasso started drawing photorealistic, virtually photorealistic for big parts of his life. He had the craftsmanship of being able to draw something really lifelike. And he eventually stripped all that stuff away and said, I'm going to distill it down to this essence. So it took him, decades of his life to get to that art style. He didn't start that way. And to me, that's the big difference. I think, you and I and others in companies, whether they run companies or teams or whatever, or individual contributors in something, you have to do that deep immersion in a topic, and then you can simplify something to other people. Even then, I think you got to watch out that you don't become a Pied Piper in any way. You want people to think for themselves, and you've got to really mean that. But I think that's sort of like where I would think. And if you're like me, and I actually think you are, otherwise you wouldn't have overlapped so much in our CVs, you probably also want to, in investor calls or investor meetings and pitch decks and so on, loves to go into the weeds. And my co-founder, Josh, and I, we have this thing where when we raise money or give investors an update or whatever, we sit next to each other so we can kick me under the table. Because when I go to, he starts kicking me and I know I have to come back up again. But it's that sort of like arts that in the right moments, maybe stay a bit higher level and get people into your narrative. And then you can sort of like expose them to more details over time. I think that's the delicate balance.
Yeah, I think so. And I don't think that's something that we're learning from the current politics. I think it's been true for a very long time that providing some kind of core orienting ideas, they do need to be simple and they need to be right. They need to be right. And you can't just manufacture them overnight. But you need to return to them, I guess. And that's what's happening when you're getting kicked under the table. And sometimes, if you're really into the detail, you're going to lose your colleagues and those around you if you don't just keep them anchored on some of those core messages. But I wanted to test this idea, right? Because you're waking up in the night worried about our politics and our society, and you're wondering, oh, maybe I need to be more like these guys, just make up nonsense and have no facts and be radically simplified. But think about the opposite point. Here's an interesting dimension on it. Some of the weirder stuff out there, especially with the right wing in the US, it's very complicated. There are these incredibly elaborate theories of the universe that these guys seem to have about all these unseen forces. I mean, if you think about this QAnon and the Pizza Gates and the behind the scenes deep government that's like undermining their savior. I mean, there's a lot of strange complexity and nuance and detail. It's just all wrong. It doesn't seem to connect at all to reality, but it seems to have some kind of coherent mythology, storytelling that makes it seem like there's some more traction to it, And I wonder how you feel about that, right? Because that storytelling is part of the job too. Making it all make sense. It's not just like, even in your story here, you can't undo the ACA. You took 1 minute, but there's a story there about the power of 50 million people and their livelihood, and there's no politician who can steal it from them, right? I mean, you have some arguments. I wonder how you feel about that, the job of storytelling at a time of great uncertainty.
Yeah, I mean, I think it's, first of all, I think it's unquestionably horrible that something like these crazy theories can even remotely become mainstream in the US political discourse, right? That's obviously unbelievably horrifying. I think it's horrifying that, that people don't believe Black Lives Matter. And I think those are all that, that there's systemic racism, discrimination still in society and so on. That's without a question still the case and usually problematic. I think if on your concrete question as to why these things resonate in this way, I definitely not an expert on this. I did at some point in my life have a gaming company. We, designed social games for a living for a couple of years of what I was doing.
I think it was one of the most successful in the world. Mario, you're a bit modest. I guess when phones first started letting you download apps, you and your colleagues had the idea that people might like to play games on them.
Yeah, it was certainly a fun part of my CV, I'd say. I started a company in business school. I basically went to business school because I wanted to spend 2 years trying to start companies. I thought business school would be pretty easy to do, most likely. I can do a bunch of coding, and so I mostly programmed a bunch of stuff. And one of the things I programmed ended up being a social network, because Facebook hadn't really grown outside the US yet. And so Josh, that's how I met him, and my co-founder at Oscar, had the idea of saying, hey, let's do a Facebook for Latin America. Yeah, okay, interesting. Like cultural transformation of a simple idea there. That's what I programmed. We launched that thing. It didn't go anywhere for years. Another friend of mine was the CEO at that time, classmate of mine. And then I saw an online game start doing very well, an online RPG in Germany. Kept reading the German press about it. It was sort of like a very crude game built by 2 high school kids, where you were, simple simulation of, I think, living on the streets of Hamburg and, like sort of like working your way up. And so we basically translated that game into a soccer game in Brazil, a soccer simulation game in Brazil, where you sort of like played your ways out of the favelas, the shanty towns in Brazil, into the national team. And that became hugely popular in Brazil. I think at some point about a third of Brazilian internet users back in the 2010 timeframe were playing one of our games. And then we couldn't make the platform paradigm shift from online to mobile. Actually, it was mobile that sort of like we couldn't quite translate into. And the shift from the local platforms to Facebook, that was the other one. Brazil had its own local sort of like platforms that eventually went down. Facebook grew, but different story. So long story short, in game design, one very well-known result is that I think it's called the Skinner box. If you want to have if you want to maximally engage the human brain, the probability of giving you a reward when you open a chest, like a treasure chest, whatever, has to be around 50%. Because then the brain just cannot tell if it's going to get something or not get something. It's very interesting because it doesn't know it's going to get something for sure. And it's also not getting too boring because, it knows it probably won't get something, right in that middle. And I think that's what's behind some of the effective storytelling of these conspiracy theories. There's enough discovery in there, enough randomness in there, that there isn't really a sort of coherence, but there's that elegance purely from the way that the brain fires in this way, and that's that, if you want to get rats maximally addicted to giving them something, you do it with this 50% probability. That's the Skinner box.
Well, Mario, we're trying to use some of these powers for good here in this conversation. We're not only to analyze perhaps some of the threats, and I guess when you're doing the work, leading an organization or trying to deal with your stakeholders, part of that storytelling job is certainly to anchor in, things that are just incontrovertibly true, and help sort of show what that illuminates or points you in some kind of direction. Hopefully not too much Skinner box, or maybe there is. I don't know. Is there?
I don't know. I think that's I think we have to. To me, that's what like civilization means, right? You gotta extract yourself from like living with simple instincts. And I think in our case, we try to completely avoid that kind of a stuff. I mean, we had actually literally in the early Oscar products, we tested in surveys, should there be more kind of like in the very early Oscar product design I did myself. You sort of like got the claims coming in, you saw your physician visits, and I had a little design where you had to click on each physician visit and sort of like get a rewards for looking at the visits, literally that way. And we never built that because I thought it would not in a good way mix the honesty, the profundity and the seriousness of healthcare with the sort of like flimsy stuff around the
gamification. Yeah.
It mixes. And I think I get concerned by that. So I think the place where you see it right now is in Robinhood's, right? That's become a hugely gamified lottery app for the most part, with all these kind of like rewards and funky animations and so on. And I think you can use this maybe in certain ways to get people to do things that are going to be good for them, but it can become a dangerous cycle that you cannot overuse these tools. And we, for what it's worth, never try to use them or overuse them, because I just don't think it does justice to the seriousness of the topic.
Let's talk a little bit. Let's return to, we took a little departure when we were talking about the all hands you did a little earlier, and what it's been like to have a company of more than 1,000 people just entirely remote for the last 6 months. And is that correct? You guys are still fully remote. You haven't opened any offices. No one's allowed to come back in. Everyone's out.
So November 9th, which is actually in about it's less than a week from now, we're gonna open the office just so people can get in if they want to, and they can have a meeting, or they can have a work by themselves in a different place, so they don't have an apartment that's big enough for them to have a kind of an isolated room.
And you're mostly in New York, right? So you're really following the rhythm of the New York office world in choosing November.
We've got 2 big offices, one in New York, and we have all the operations in Tempe, Arizona. That's actually an even bigger office. New York's about 700 people. Tempe's about 900 people at this point. Both have been totally remote, and both are kind of opening in this kind of small way, but it's totally voluntary for people to go in. And I think I'll probably be there. I'd say probably maybe once a week, once every 2 weeks or so, because my wife's also would be worried if I still kind of traveled and too much, even to the office, and so we want to sort of like do this at the right level.
Yeah, folks are easing back into it across our portfolio as well. Certainly, the U.S. has been the slowest. Most of our customers are in New York or San Francisco in the U.S., and these have been very cautious markets. Yeah. But I think you may be rare in that you haven't opened at all yet. Most of our customers have an office that's open at least. And I think probably for the same reasons that you're thinking about it now. Some people just need somewhere to go. I mean, it becomes crazy at a certain point, especially families, children, whatever. Yeah. And sometimes there are things you just need to do in the office. I was in my office. I've started to go back about once a week or twice a week over this last month. So we're sort of following the rhythm of our customers and, edging back in. But I noticed something immediately, and it has been on my mind for months. We've been trying to stay connected. Really, we have, video, all hands, whatever, lots of meetings, informal meetings that the meeting is just about catching up with someone, I don't know. But now enough time has passed that I have seen the change in my personal network in the company, and it's a lot smaller. It's less heterogeneous. There are so many people I don't know. There's all these people who joined the company. I have never met them. I couldn't recognize them. Their name is vaguely familiar. Yeah. It's just a totally different company now. I'm like running it like it's a video game almost, where there's 10 people I talk to and everything else is just a black box. This is not a good thing, even in all hands, right? I mean, you and me, we're in front of a bunch of people right now on video, but it's really just you and me looking at each other. Yeah. We're not so connected to the others, are we? I mean, tell me what have you lost through this period?
So actually, as I was thinking about what I was going to say there, as you were talking, I was going to say exactly that, what you just said, which is the network in the company has changed. There are people who I see in certain meetings, typically, who I just haven't seen in months. And because also it's pretty seasonal in that we have an open enrollment period that is happening right now. People sign up in open enrollment for the next year. And so in that period and leading up to it, we have different kind of cadence of broader meetings. And there are people who I typically see in these open enrollment meetings that I haven't seen rest of the year. And usually if we were in the office, I would run into them and say hello and chat with them and stuff like that. I haven't seen them in 6 months, and I saw them on the list and like, oh yeah, this person, great, still there, awesome. I'm looking forward to a conversation again there. And that is definitely a problem. I think that you just don't have these random occurrences for sure. The other thing I noticed recently is we're looking for a C-level position at the moment, hiring for a certain C-level position at the moment, and I'm in the kind of thick of the interview process there. I'd say probably spending about 10 hours or so a week at least on that one position. And I had a conversation with one candidate there over video, and wasn't that excited, and then invited the candidates for a lunch in person. Actually, person happened to be also in New York. Had a 2-hour lunch, and it was completely different. Just a very different chemistry, connection, and very different intellectual quality of conversation. And so there's obviously nothing in this format that would keep us from saying the words we're saying. But there was something about that sitting in person, even though there was like whatever glass next to us and we're sitting apart and all these things, right? Obviously, got to follow the rules in a really meticulous way there. That just made a big difference there, and that was a big A/B test for me in this case. That just really still matters a lot. And so, the other thing I find funny is that nobody looks each other in the eye anymore, right? I mean, I'm looking at you right now, and you're looking into your screen, and we're actually not eye level. That's a bizarre side effect, but let's see how we're going to get out of that one.
Yeah. I mean, I agree with all this stuff, and it's like all these are intangible things that folks are saying, oh, well, whatever, we can just work from home, digital, everything will be different now. But I think folks have not really quantified the benefit of these things, right? So it's sort of hard to say like, oh, therefore we need to hurry up and get back in person, right? Like, how do you trade off? There is no trade-off. It has to be safe. People have to be comfortable, and then we will do this. But we know there's something that we want there.
Yeah.
And what's so weird when people predict that you'll never go back, because sometimes people have been ruminating this way, when they make that prediction, they forget why it was all worth it before. Like, it was all so worth it. I mean, like my friends at the Googles and the Twitters or whatever, literally a year ago, they are absolutely convinced that everyone must be together in Mountain View face to face, creating all the best things in the world.
Yeah.
How can that reverse in just a few months? It's just not possible.
Yeah, I know. I mean, the pandemic is in so many ways an exercise in that, right? I think this about masks. I remember how surprised I was to see people with masks in the March-April timeframe when I took the kids outside, whatever, and it was full on raging, the pandemic, right? I mean, New York was shut down, but you couldn't really buy masks in those days because the PPE stock was so low. I was like, oh wow, masks, that's an interesting concept. Why is a person wearing a mask? And a month later, it would be the exact opposite. You're like, why is this weird? I'm not wearing a mask. This is crazy, And so the shift in perception there, this is another study in oversimplification, right? The tech companies are not right about everything, right? The extremist positions you can have in almost everything are almost certainly wrong. It's just, again, an exercise in that same thing we talked about earlier. Look, I think when it comes to work, I really think there is a chance of building a different kind of future. We've been trying to think about this at Oscar as well. I've been telling our people team, Carrie, who leads our team valiantly, to really steal everything she can from every other big company that's had teams running against the future of work, right? We should also be creative. We should invent our own Oscar-specific future of work. But there's stuff we can learn from everybody else. We should just shamelessly copy what others have found there. I thought early on that I was really wondering, should we shut down the big Oscar office in New York and basically have 5 offices in New York, And the old saw, I think it was in the Kahneman book, that's one of the best things you can do for your brain is to kind of take a different way to work every morning. Simple thing you can do. If you had 5 offices in the same city that are all much smaller, you could almost like tell people you got to rotate, and even that by itself would create a certain excitement about being in a different place with different people together and whatever. And then part of the week you spend from home. There's something there, I think, in how this could work, even if you're in the same city and not across the world.
Yeah, I think you're right. I mean, some of our customers are now really engaging with us on this topic. I guess the shorthand is hub and spoke. So if you used to have one giant office, maybe everyone doesn't feel comfortable being in one giant building right now, and the commutes and whatever. Maybe at least for a year or two, you'll have some peripheral other locations. Maybe they're more convenient. Maybe you can drive there, walk there. But there is a job to do in the office. A lot of it is the stuff that you were talking about being together. But the job that's missing right now, and if I was, the head of people in a company or the CEO of like the way you are in your company, what is the experience of working at Oscar? What does it feel like to them? Because if it just feels for your people like being on Gmail and in a Zoom call and being on whatever, like it feels the same as every other company. There's literally no difference. Like you have to remember what you're doing, but it just feels the same. Whereas it used to be that people would not only see and be around their colleagues, but to be in an environment that really reminded me the purpose of their work. And I mean, that's the experience of the space gives you a lot of opportunity to connect with and shape the way your people are motivated and how they're connecting. I don't think you can do it just with these digital tools right now.
No, I don't think you can. I think that's right. Again, I think not to go too psychological, why does Disney, pump like, things that smell in a certain way into their parks? Because, the brain will associate that with a good time you had and whatever, and you can then jump right back in and create the same mood again if you go back to one of the parks. And I think work can be the same way. You can have great moments at work. Hopefully the company creates a space for you where you feel safe and heard and you feel productive and so on. And you start associating that with the sounds and the smells of being at work and with your coworkers. And I think that's hard to, anyhow, we're not going to replicate that anytime soon if we're totally remote.
Yeah, well, sometime soon we will meet again. I'll come and visit you when you open your place in the next few weeks.
Exactly.
It's been amazing talking with you, Mario. Thanks for making some time to talk about all this like vast range of issues. The work you guys do is very important, and I wish you lots of luck. Hopefully, your people are safe as you start returning to working together.
Thank you. Same to you. And what you're doing has always been incredible. I know we've been a customer of Knotel actually before we moved into our new office, so it's been super helpful, and people love the experience. And so,
that's good. That's good.
If you have
very nice of you.
I'm always actually reading the posts you make on how you think about the future of work, because I really think there's a big way to redesign this thing, and so I hope you can play a big role in that and help us with that as well.
We will accept the duty from you. We'll do our best. Thank you. And thanks everyone for watching. We're going to save the recording and we'll share it at Knotel. And you can find Mario and other folks who've talked to us about how they're planning and leading. Bye, Mario.
See you soon, Amol. Thanks. Bye.